Behavioral Health Services North has opened 2 new residential crisis centers in Plattsburgh to allow individuals in crisis to receive short-term recovery and support services.
We first started this journey 5 years ago in 2019 with the initiative to be able to open up these houses and help transition people out of the hospital or prevent them from going to the hospital. We have been really focusing on creating an opportunity to assess the gaps of services and make sure that we're doing everything that we can to increase access to care.
Associate Director of Crisis Services, Kourtni Souliere, says the residences, one for adults and another for children and teenagers, will provide a safe environment and referrals for treatment and recovery.
We are opening our crisis residence. It is a program for people who are struggling with mental health crisis, who either don't meet criteria for admission and we're hoping to divert, or have been in a long-term higher level of care and transitioning out.
Having a way to be able to provide services for structure, for a safe place for people that may not quite need the hospital or may be transitioning out of the hospital is a very important service to provide. So I think this is amazing because I think it will fill some gaps that we've had.
Assemblyman Billy Jones says hospitals have told him that projects like this are desperately needed.
I would visit the hospitals and I would say, what is needed for people in crisis that are having issues, substance use, mental health, behavioral health issues. And they said they needed a transition. We needed a place for that they could get stabilization, that somebody could fill that void that they needed to go on to make sure that they were productive in their lives. So I am very happy to be here today in recognizing BHSN for filling that void and filling that gap. It is needed.
The Adult Residential Crisis Center, which has 6 beds, opened in September. The Children's Crisis Center, which has 4 beds, has been open since last November. Both of the centers will be open 24 hours a day, 7 days a week. And we are joined now by Katherine Cook, who is the president and CEO of Behavioral Health Services North, and Kourtni Souliere, as we mentioned a few moments ago, is the associate director of Crisis Services. Welcome. Nice to have you both here.
Thank you for having us.
You cut the ribbon just a few weeks ago to officially open the new adult residential center. As we mentioned, the Residential Crisis Center for Children has been open about a year now?
Yes.
Last November?
Yep, last November.
And we heard many of the speakers at the event that day say that this is something that's been needed for quite some time.
Yes, absolutely. Offering children and families an opportunity to have a place to come and receive services and really take time to be present and attentive to those services and allow them to work through the barriers that may be challenging them at home, but keeping them out of a hospital or a higher level of care.
And what will this do? How will this help?
So it's an option to divert somebody from needing a hospital or higher level of care, or if someone has been in that higher level, it's a place that they come receive support for a period of time until they're ready to transition back into their home setting.
And a safe place, and that's important?
Yes, absolutely. We have 24/7 staffing that can help with learning daily skills, learning coping skills, navigating resources in the community, and really just being there as a friendly ear to offer support.
Is that something that's been missing? Is this a type of service that's really been needed?
Absolutely. A lot of services, hospital short-term, outpatient services are intermittent, so someone may have a session once a week, but this really offers wraparound support. So making sure that those social needs of food, clothing, shelter are met, at the same time their healthcare and mental health needs are met as well. Supporting school needs, vocational needs too, really offering the person the whole wraparound service in a more coordinated setting, while still allowing them to go out in their community and participate with people that they find beneficial to their life.
And Katherine, your Vice President of Operations and Clinical Services, Liz Cole, said the day of the ribbon cutting that this has been in the works for 5 years, that planning for this began before the pandemic, back in 2019?
Yes, definitely. The team has worked arduously to launch, and this resource, when you think about it, prior to the opening, folks would have to go to the emergency room if they were looking for care or services and support. And with Kourtni's team being able to meet with folks out in the community, that was part of our mobile crisis services that you had offered. But then the team working together to create this stop allows for folks to not have to go to the hospital if they don't need that level of care. And it's certainly a less traumatic experience, particularly for young people, but also for adults.
And it's a home-like environment,
Yes.
which I'm sure is by design.
Absolutely. So both of them are converted residential homes. Bedrooms are very standard: bed, nightstand, kitchen, dining, family-style dining, place for people to be able to learn those skills to cook a healthy meal and not feel like they're in an institutional setting.
So the adult residential center has been open for a couple of months now. As we mentioned, the children's home actually opened about a year ago. How successful has that been? What sort of numbers have you seen?
We've had about 150 referrals since we've opened. We have about a 60% admission rate depending on wait lists and people being appropriate for that level of care. We have an 80% successful discharge rate, which means that people are transitioning back into their home environment successfully. And the average length of stay is about 14 days for the children, and our average age of admission is 13, but we can serve in the children's program children from 5 to 21.
And you mentioned the average stay of length is about 14 days,
Yes.
but they can stay for up to 28, almost for a month if they need to?
Yes, so it's completely voluntary. Some people come for a day or two, depending on what their needs are. Some people stay that full 28 days.
The residential center program has been a long time coming, as we said, 5 years into planning. Is there still more work ahead to meet the community's needs?
We could expand.
Certainly, there are ideas in the works where we could perhaps offer more beds both for adults and young people.
We also want to talk about a special event coming up in a little more than a week on November 19th. There will be a screening of Ken Burns' documentary, Hiding in Plain Sight, his critically acclaimed documentary that aired on PBS. It really gave a voice to the experience of young people struggling with mental health challenges, focusing on the importance of awareness and empathy. And again, you folks are having a special screening at the Strand Theatre coming up November 19th at 5:30?
At 5:30, yes, and it's free and open to the public. And certainly it is an opportunity to come and see a portion of the film that was made by Erik Ewers and his brother Christopher. And it really shares with us the journey of a number of youth that have experienced mental health challenges and crises. So Erik will be joining the panel discussion after the film, as will one of the youth from the film, to help us talk about this important issue and to really shed a light on youth mental health needs and how we as a community can support our young people. It also happens to be our 150th anniversary at Behavioral Health Services North, and we're happy to share this event with the public as we celebrate our anniversary. And we've invited other key community leaders to be on the panel who are also working with young people and their mental health needs, so that together we can make an impact on this very important issue.
So right after the screening, you will have a panel discussion.
Correct.
And what are some of the topics that you hope to cover in that panel discussion?
Well, certainly I think we will ask the filmmaker what prompted him to make this film, why this film and why then, and also to be able to hear why the youth who participated in the film felt it important to participate in the film, and how being involved in the project helped them, and what advice they offer to other young people and to families. So I think that those are some of the key takeaways, but also just really the importance of being able to form a sense of community and have somebody to talk to or talk with about any mental health challenges that a person is having. The reality is when someone's in crisis, they need somebody to connect with and to talk to, whether that's somebody from our agency, whether that's somebody from a peer support agency like NAMI. It is important to communicate with somebody, and together we'll be stronger and provide that safety net for all of our young people.
And this really, nationwide, was critically acclaimed,
Yes.
this two-part documentary.
I think another beautiful thing about the film is that each film that the Ewers brothers are making over the next few years relate to mental health. This is just a first of a series, so we'll be able to be looking forward to an adult mental health version. And with that being said, this current film that we'll be reviewing on the 19th has a curriculum attached to it that allows for schools and other educators and counselors to use that curriculum along with the film to really prompt communication and guide discussions for addressing one's mental health.
And as you mentioned, the Ewers brothers, teaming up with Ken Burns, they are already working on a follow-up to this, which will be coming to PBS in the coming months.
Yes.
For you, this is personal. You got to know a number of the members of the production team, also some of the young people who participated in the documentary.
Yes, I've been involved for a little over a year with Ewers Brothers Productions. You know, this is a topic that's near and dear to my heart. I've been working in the mental health field for over 30 years. I live near Ken Burns and always challenged folks to make a mental health movie or a movie about our service sector. And I'm so grateful to Erik and his brother Christopher for tackling this really important topic. If you watch the full 4-hour documentary, you can really get a taste of the young people's story. And what has been most fascinating is to see the hope and the recovery that is possible, and how well the youth are doing now after years of both talking about their story and engaging in services and promoting their work.
And what are you hoping the folks who attend the screening will come away with?
Certainly that there is hope, and certainly that recovery is possible, and that when you find your person, when you find someone to connect with, that starts your journey of healing. And that as a community, we can create those types of spaces, whether that's accessing services at an organization like ours, or just creating space within the community to have a dialogue about health and wellness. That's what we hope for.
And if folks would like to attend, it's free and open to the public. Do they need to reserve a seat in advance?
No, they don't need to reserve a seat in advance. There's a lot of seats at the Strand, so we invite folks to come.
Is there information on your website if they'd like to learn a little more?
Yes, certainly they can look on our website, and we will be available to answer any questions that folks have.
Katherine Cook and Kourtni Souliere, thank you so very much for taking the time to be with us.
Thank
Thank
you
you.
for having us.